Nobody knows how close to homelessness they are. Most of the time when you actually get that backstory and you realize it was one or two things that led to this person being on the street. And the longer somebody spends on the street, the more difficult it is to get back into housing.
CalAIM, the California Department of Healthcare Services initiative to transform Medi-Cal, recognizes there is no one-size-fits-all solution to homelessness. 5 Cities Homeless Coalition uses CalAIM funding for programs that provide personalized paths to permanent housing.
We serve populations that are currently experiencing homelessness, either living on the street, in their cars, in motels, doubled up with other households. But we also serve people who are at risk of homelessness. So they might be in housing right now and they can't pay their rent, or they've gotten a notice to vacate and they don't know what they're going to do next.
I think there's sometimes misconceptions of why people are out on the streets, and while some of those might be true, a lot of the time it's a result because of other things. I think these people are really in need. They're just asking for support with their situations that they're going through.
So this is really that hands-on support with those clients to make sure that from start to finish, they have all the resources that they need to access these services and what we can provide in terms of resources after they've moved in.
They lack, access to healthcare, lack the rental history or the criteria that a lot of property managements and owners are looking for. There's a lack of affordable housing for sure.
Being able to provide something like a landlord incentive to help move somebody in, it's that extra assurance that, if something goes wrong, your costs are covered. And, with the CalAIM and the Housing Sustaining Services, not only can we provide some extra incentive, but we've also got the case management that's coupled, with that.
My name is Monica. I became homeless through a series of events that took place. And my mom passed away. The grieving process was very difficult for me. I started having some issues with PTSD and depression. I had relapsed as well. I'd been clean and sober for about 6 years, and so everything just kind of compounded and started to unravel for me.
She is a prime example of somebody who, just needed that kind of short-term help get me back on track. And it's just incredible to see for someone who really is just ready to put in the work. There's a lot of pre-work that goes in terms of the applications and the navigation, but we can't just put somebody in housing and expect them to be successful.
Not having a stable place makes everything unstable, basically. 5 Cities Homeless Coalition, their help and support has been a game-changing, life-changing situation for me. They gave me dignity, and then they had solutions that were attainable, and they treated me like a person, a human. So that, for me, at that particular point in time, I needed that the most, just having compassion.
I will meet people halfway if they meet me halfway. I think we're never gonna do more than the client's doing. We really try to empower clients to have leadership and really kind of take the first step towards whatever their goal is.
I think, what CalAIM is doing and providing these services is going to ensure that once we move people back into housing, that they're actually able to sustain that housing and they're not going to fall back into homelessness.
It's been stressful, but thank God that I have a place to be able to just be private, heal, and begin the process. So it's increased my faith, felt so much more support. I have a place that I can call my home. So in that sense, I feel like I'm beginning to get my footing. One of the big things too about being here is that I feel so safe. I just feel so absolutely safe, and that's such a blessing.